two lawmakers you just heard from are joining us right now. Democratic Congressman Eric Massa of New York and Republican Senator of Wyoming, John Barrasso. Gentlemen, thank you very much for joining us.
Thank you.
Good morning.
Congressman Massa, let's start with you. I know that you have been a big supporter of the public option. And last night, the president pretty much walked away from that. He said he'd like it in a perfect world, but it doesn't sound like that's going to fly. How does that make you feel? And are you less likely to support the president's bill if there is no public option?
Well, that's not exactly what I heard. But let's not call it a public option anymore. Let's call it the congressional option. And let's require every senator and every representative to be subject to whatever provisions of this plan become law. I'd like to take a moment to ask the senator if he would join me, as I have already done. I have forsaken the Congressional Health Care Benefits Plan because I receive my health care as millions of other veterans do. I'd like to ask the senator and all of my colleagues to do the same. Let's make it mandatory for Congress and optional for the American people. Senator, will you join me in that?
Sounds like a Democrat just wanted to make something else mandatory. All they ever want to do is make something mandatory. I want to give Americans choices. I want them to allow to buy insurance across state lines. I want to deal with the liability issues that, former Chairman Dean says, oh, no, we're afraid to take that on. We don't want to deal with the trial lawyers. I think we need to really take a look at this. It sounds like a Democrat versus Democrat debate going on in Congress. I want to have change, but not the thing that, the president, I think, set up a false choice. He said either the status quo or this massive government takeover. And I don't think we need that massive government takeover. But the status quo isn't enough.
No, Senator, you're not answering the question. How can you, as a lawmaker, receive taxpayer-funded health care, a Cadillac plan, when tens of millions of Americans are being cut out of health insurance by incredibly high-profit private health insurance companies?
Tens of millions of Americans ought to have the same insurance policy that members of Congress can. You ought to give all those opportunities, all those choices to members of the public. Every one of them.
Lead the way,
Take them all in there.
That's the problem here.
Senator,
I practiced medicine for 25 years. I've seen it all. My wife's a breast cancer
survivor. Well, I'm going to get a word in edgewise, and the senator's going to talk for the entire segment.
Okay, let's have a ground rule, one at a time. Senator,
well, then
go
call
ahead.
Time, because even though he's a senator and I'm a congressman, we have ideas that have to be heard. I asked him a simple question, and he twisted it into partisan politics. That's what we're seeing. Yeah, that's what the president addressed last night.
I've never seen that happen before. Hey, Congressman Massa, let me ask you this. Last night, at the conclusion of his address, the president did talk about how, I've heard a lot, we've all heard a lot, that tort reform could actually help in the situation. Yeah. And he talked a little bit about maybe he should look at it. Are you for tort reform, essentially?
Personally, not only am I for it, I've been talking about it in dozens and dozens of town hall meetings. I like what some states have gone to, where we have groups of doctors who stand between predatory lawyers and malfeasance insurance companies and actually act to get rid of some of these incredible litigious lawsuits that drive up costs and force doctors to practice defensive medicine. It is a true bipartisan hand across the aisle. But as long as the other side stands in the wall of the House and shouts and calls the president a liar, we will never find the solutions that we need to help the American people.
Congressman, I do believe I heard the president last night say it's time to stop the bickering. Senator,
I agree.
We all agree. Senator, the problem, Senator, is the fact that early on the president made some deals. He made deals with Big Pharma. He made deals with the hospital group.
All the lobbyists, all the people he criticizes. There he is, cutting deals and cutting out the American people, and it's a disgrace.
So what do we do about it?
Well, we bring the American people in. We say, what voices did we hear at town hall meetings all around the country where people said, we don't want a government takeover. We want some changes. We want some reform. We want more choices. We want to be able to buy insurance across state lines. We don't think we should penalize people who buy their own insurance, but you got to deal with these massive expenses of defensive medicine and lawsuit abuse.
All right. Gentlemen, it's been a spirited debate for this Thursday morning. We thank you both for joining us, Congressman Eric Massa.
Early in the morning. Thank you very much.
Yes, indeed. And Senator John Barrasso, Senator from Wyoming. Thank you, guys.
Thanks, Steve.